Hi, and welcome back to another episode of PainFreeFinally.com. I'm your host, Greg Roulette, here with Houston's senior specialist, Dr. John Parks Trowbridge, and we are talking about one of the most important things on our body. We use them for pretty much everything. That's our wrist, that's our hand, that's our fingers. It's really funny. I mean, pretty much everything with the body, we take it for granted until we can't use it anymore.
Totally.
But how much, when you're like, oh man, I can't hold a fork, I can't hold, I can't brush my teeth, I can't do all of these things that require this really important part of our body. And some people have gone through this pain for months, for years and years, and then they come to see you. And you talk to them about, how you can really help them to be pain-free finally.
Exactly. The wrist is very, very complicated. There's the two bones that come down from the forearm, and then these zillion bones, which this model hides. But there's very difficult to operate on these tiny little bones there, and their little support structures and such, leading off to the hands and the fingers. But when you stop and think about it, if you want to pick up a cup of coffee, if you want to do writing with a pen or a pencil, if you want to point with your finger even to do an iPad.
Put the keys in the car and turn the ignition on.
That's a good one, actually. I've had that kind of issue myself before. Anything that you might want to do with your hands, get dressed, do the buttons and whatever, okay?
Yeah.
That is now a limiting factor that distresses your comfort because your capability is impaired. Now you're someone needing help.
Yeah.
Well, now wait a minute. There actually is help available because treatments that we do, the prolotherapy, reconstructive therapy, and the stem cells can be absolutely dramatic. Now, when we talk about wrist, mostly we're talking about pain.
Yeah.
People have fallen on it, they've twisted or stretched it, whatever, and now it doesn't quite go back the way it used to because, as we've talked about, the support structures, the rubber bands and the joints don't heal as well as other parts of the body.
Right.
And so they linger, and when they linger, they're calling for help, called inflammation. That's the pain.
Yeah.
That's why you end up taking drugs. That's why even surgery is proposed, which sometimes gets very complicated on the hand or the wrist.
Definitely.
And stem cells are magic.
So let's talk about that, a little bit of the difference. We've talked about them in previous episodes too, but just in case they haven't seen them, again, surgery or prescription drugs is usually the first, offer to you to get rid of some of that pain.
That's the kind of doctors we have.
Yeah.
So, if your doctor prescribes drugs, you're kind of hopeful.
Yeah.
And eventually kind of desperate, in which case if the doctor
and it might mask the pain to get you through, a little bit of the day, but it's masking it. It's not actually helping you. The drugs aren't healing your wrist.
There's no repair that's happening. Exactly.
And what we really want here, in order to be pain-free finally, is repair.
Right.
So let's talk about how stem cells actually repair the wrist.
Great. It's kind of anticlimactic, okay? we find the spots that need to be treated. Okay, so I've got x-rays, I've examined you and so on. So we know what we're doing. We go into those spots and we inject a little bit of fluid with the stem cells in them. Very unique, special ones that are highly active, ready to go, safe and ethical and effective, okay? And what they do is they start repairing the tissues that they find that are inflamed. That's the signal to tell them where to go. And over time, it can be absolutely remarkable. One of the problems that people get is rheumatoid arthritis in their wrist.
Right.
Now, let me tell you, that is a painful wrist. Almost any motion, it doesn't have to be one where you're trying to do something. Just almost any motion. This can be incredibly effective for that, not just in the wrist joint, but other joints as well. And so the beauty of it is over a fairly short period of time, you remake the tissues that got stretched and injured.
That's amazing. So it's actual repair.
Real repair.
Rather than masking or just, you talked about it earlier, surgery, taking out, putting in. It's not, pins and needles and a metal wrist. It's actually putting your wrist back how it was meant to be.
And you do it because God put the plan inside. It's very simple.
Yeah. Now, how do you know if you're the right candidate for stem cells to repair the wrist?
Gotcha. Here's the deal. If you're suffering and you have to have your wrist, or
which you do,
which most people
which is you and me and everyone watching.
Most people. Or if you're suffering a long period of time, nothing else has seemed to help, especially if you've been recommended to have surgery, that's the ideal time to make sure you find out about our kind of stem cells. Because the key in getting the right treatment is, number one, having the right condition, number two, having the information necessary, and asking the questions that you need to ask, which is why we have the book, the DVD, the website. The idea is get you up to speed because you want more. You don't want just, regular stuff. You want the best that I choose for me, for my healing and repair.
Yeah, well, you deserve more, right?
Exactly.
And you watching deserve more. Now, what I love about what you do is you're very transparent in saying, this will work for you. This has a good chance of working for you, or it doesn't, right? And that all starts by going to PainFreeFinally.com, filling out this little quiz that you put together. Exactly. You have the questions that you need in order to make that initial assessment, and then you see them, and you see if this is the right procedure for them to get them pain-free.
And they can send us information. They don't have to see me first.
Yeah.
They can send me x-rays, they can send me description and concern, so that what they have is an opportunity to really know.
Yeah.
Know before you leap.
Exactly. Yeah, you empower them with education, with information, and allow them to make that informed decision. And so we've talked about the wrist.
Right.
But right along with the wrist is, well, our hand and our fingers. They're right there, right?
Exactly.
So let's talk about how that applies to this as well.
People injure their knuckles all the time by doing stupid things like playing ball, or falling or grabbing something or whatever.
Yeah.
But when you injure, it's the same kind of thing. These are tiny joints, tiny support structures.
Yeah.
And sometimes, we had a lady years ago, and I was not using stem cells at the time. She was a typist on disability because she could type 150 words a minute, but not with the finger injury. Very quickly healed that up. Stem cells would have been one treatment. On the prolotherapy, it was several more.
Yeah.
But the neat thing is that we can turn on your healing so that you can become comfortable and capable.
Yeah, and just like with the wrist, the first step is getting to PainFreeFinally.com.
Exactly.
Filling out that quiz. Getting you some information so that you can, best diagnose it and help them.
What people want is a result.
Yeah.
And that's what I'm out to deliver.
Exactly.
Because they deserve it.
They deserve it, and you deserve it as you're watching this right now. So head on over to PainFreeFinally.com, fill out the quiz, let the doc know exactly what is happening, what you're feeling, anything that you have that will allow him to make an informed decision so that you can get the right treatment to make you pain-free finally. Thank you guys so much for watching this episode, and we will see you in the next one.